Every year on 14th of November is World Diabetes Day. Mengo Hospital organized a diabetes camp under the theme, sharing knowledge to improve diabetes care in commemoration of the day.
This is a day that's aimed out to spread awareness about diabetes. What is diabetes? What causes diabetes? How can we combat diabetes? Where do we stand as a country with diabetes? What do we plan to do for diabetes? What are the new advances in diabetes? We are preaching the word of early diagnosis. People should come for checkups and they should know how they stand as per diabetes. Many of you have brothers and sisters, mothers, fathers, grandparents who have diabetes, and you've never bothered to go check for diabetes. Yet these are non-communicable diseases, meaning you cannot spread it from one person to another through contact or through hands. They are genetic diseases. So we encourage people to just come and know, get to know how you stand as per diabetes. What's your sugar like? Is it normal? Is it abnormal? How are we doing with diabetes? So basically this day aims at spreading awareness about diabetes. First of all, to know what is diabetes, who are at risk of diabetes, the complications of diabetes.
This year's celebration is centered on creating diabetes awareness and educating the mass. The camp included free health education talks, free complication screening, free blood sugar and BP measurements, diabetes care services exhibition. The camp was filled with people who got services from the facility.
Come to know more about this disease, the diabetes. So, because you might find that there are new things concerning about this disease. But mostly, I know most of the things because I've been with this disease for almost 22 years. So I know what to do, I know how to go about it. And so I came to know mostly the new things about the disease, the new medicine.
Kuno wane Mengo ogwa Diabetic Association okuba ntusoma abantu batongeramu obukugu n'okuyigirizibwa engeri y'okufuna ebyokulya byaffe n'ebyokunywamu n'engeri gyesobola okwejjanjabamu. Era kati nzize wano tuli bayitukolako tuli kumaze okulaba ebyokulya ebatusomeseza ebitugenda ebintu bikyalire mu maaso tugenda kulaba n'omusomo ogenda kutandika tubere nga tweyongerayo.
Badde ndese maama wange okumukeberako olwaleero nemba mukozeeko bulungi n'eddagala tulifunye.
The commemoration day was full of health activities from different health practitioners and organizations like Uganda Non-Communicable Disease Alliance, Uganda Diabetes Association, among others.
To give you more understanding. For example, we're having free eye checkups for diabetes. Number 2, we are having dental checkups. As in line with diabetes, we are having foot checkups for diabetics. Many of you have seen diabetic patients whose feet have been cut off, legs have been cut off, they've lost fingers. This is because of complications of diabetes. So we don't want it to get to that point. We want to catch it early so we can help people. We are having nutritional advice. As we know, the 3 pillars of management of diabetes: exercise, nutrition, and then medication. So people are getting to know what to eat, how much to eat, what to eat. All that is being organized, especially those with diabetes, and free medication. We're having free vaccination for COVID-19 as well. We're having many partners who have come to showcase partners in management of diabetes, those who import drugs for us. They are those of us who need footwear for diabetes. We have our brothers Bravo Shoes, who have done a lot of research and a lot of work in footwear. And this day basically we are calling upon all those with diabetes to come and know their standing.
Charles Oyo, the Commissioner for Non-Communicable Disease in the Ministry of Health, who was also the guest of honor at the camp, urged the public to collectively fight diabetes and called upon people to change their lifestyles. During the ceremony, the Commissioner further said the ministry is working with different partners to address the problem and strengthening public health partners to reduce on the diabetes-related deaths.
And most of these are mainly in low and middle income countries, of which Uganda is one. and it contributes to about 1.5 million deaths worldwide. And that is quite big. If you take like, I think some regions of the country, the population is less than 1 million, or could be around there. This could be about 4 or 5 districts combined, if we are to bring that to our local context. And that is quite high and is not acceptable. So we are aware that the number of cases, new cases, and those who are dying as a result of diabetes has been increasing over time.
Dr. Ezra called upon the government to support the initiative against the silent killer.
Gets to everyone. We've involved Ministry of Health because they are partners and they're regulators, so that they can join us in a way to spreading these guidelines to the rural areas, and also fighting with us to get more funding so that non-communicable diseases can be taken.
Diabetes Day is marked every year on 14th November, the birthday of Sir Frederick Banting, who discovered insulin along with Charles Best in 1922. It was first created in 1992 by the International Diabetes Foundation and World Health Organization. Diabetes is a chronic disease where the pancreas does not produce enough insulin. World Diabetes Day is the world's largest diabetes awareness campaign, reaching a global audience of over 1 billion people in more than 160 countries. The National World Diabetes celebrations will take place on Wednesday, 16th November in Luero. Anslem, Ojaru, live at 8.